1. AFib medication fears, why treatment benefits outweigh risks. 2. Understanding atrial fibrillation, risks of medication versus doing nothing. 1. AFib medication fears, why treatment benefits outweigh risks. The hidden dangers of untreated atrial fibrillation, a wake-up call for patients. Imagine living with a condition that puts you at a 5% risk of developing a blood clot, transient ischemic attack, or stroke every year. Sounds alarming, right? This is the harsh reality for individuals diagnosed with atrial fibrillation, AFib, a heart condition characterized by an irregular and rapid heartbeat. But here's where it gets even more concerning: some patients are hesitant to take the prescribed medications due to fear of serious side effects. Are they being foolish, or is there another way to manage this condition? Take the case of TB, who was diagnosed with AFib after experiencing 6 episodes of fast, irregular heartbeat. The cardiologist prescribed Eliquis and Amiodarone, 2 powerful medications that can prevent blood clots and strokes. However, after researching the possible side effects, TB became reluctant to start taking these medications. The fear of serious side effects, including death, was overwhelming. But here's the thing: the alternative to taking these medications is not a risk-free option either. In fact, the risk of developing a blood clot, transient ischemic attack, or stroke is significantly higher when AFib is left untreated. Many studies have shown that the benefits of taking these medications far outweigh the risks. Large-scale studies have consistently demonstrated that the number of adverse events caused by untreated AFib is much higher than the number of adverse events caused by the medications themselves. So, what's the best course of action for patients like TB? It's essential to have an open and honest conversation with their cardiologist about their concerns. By working together, they can design a treatment plan that minimizes the risks of side effects while protecting against blood clots and strokes. There are alternative treatments to Amiodarone, but Eliquis and similar medications are currently the most effective options available. The power of creatine supplements for seniors. As we age, our bodies naturally lose muscle mass and strength. But what if? 2. Understanding atrial fibrillation, risks of medication versus doing nothing. Dear health advocate, an elderly man's reluctance to take AFib medications raises valid concerns. But is doing nothing a better option? Expert opinion, https://www.healthadvice.com/expert-opinion. Published, July 17, 2025, 9 a.m. Dear health advocate, I'm an 83-year-old gentleman who has maintained a healthy lifestyle throughout my life. Until recently, I've never encountered any heart-related issues apart from managing my blood pressure. However, earlier this year, I experienced several episodes of an accelerated and erratic heartbeat. Upon consulting a cardiologist, I was diagnosed with atrial fibrillation, AFib, and prescribed Eliquis and Amiodarone. After conducting some research, I find myself hesitant to start these medications due to the alarming potential side effects that could prove fatal. My inquiries are twofold: am I being irrational by refusing to take these medications? And, are there alternative treatments available for my condition? Concerned senior. Answer: I empathize with your apprehensions regarding potent medications such as apixaban, Eliquis, and Amiodarone. These drugs, despite their efficacy, indeed carry certain risks. The primary concern with Eliquis is the increased likelihood of bleeding, whereas Amiodarone can induce toxicity in various organs, including the lungs, thyroid, liver, and eyes, and paradoxically, may trigger further rhythm abnormalities. However, it's crucial to consider the alternative, which is significantly more perilous. By choosing to forego treatment, your annual risk of developing a blood clot, experiencing a transient ischemic attack, or suffering a stroke escalates to approximately 5%. If you've witnessed the aftermath of a severe stroke in someone close to you, you'd likely prioritize preventative measures. Extensive research has demonstrated that although these medications entail risks, they are substantially lower than the dangers associated with untreated AFib. Numerous studies involving individuals with AFib have revealed that the number of adverse events resulting from neglecting treatment far outweighs those attributed to medication side effects. While alternatives to Amiodarone exist, Eliquis and its counterparts are currently among the most effective options for preventing strokes. Amiodarone stabilizes the heart's regular rhythm, but your cardiologist might opt for a distinct, safer medication that maintains a healthy heart rate. I strongly advise revisiting your cardiologist to discuss your reservations openly. they can tailor a treatment plan that safeguards you against blood clots and strokes while minimizing drug-related side effects. Relationship dilemma. Best friend's imitation feels more like intrusion than flattery. https://www.healthadvice.com/relationship-dilemma. Family dynamics. Sister's business enthusiasm turns family gatherings into sales pitches. https://www.healthadvice.com/family-dynamics. Ethical quandary. Why is my family urging me to forgive two troublesome siblings? https://www.healthadvice.com/ethical-quandary. Dear Health Advocate, I'm a 68-year-old woman enjoying robust health and not reliant on any prescription medications. I engage in rigorous free weight lifting sessions thrice weekly and walk 2 miles daily. I'm curious about your perspective on creatine supplements for seniors. Every source I've consulted suggests that it aids in decelerating the aging process. Fit Senior. Answer: creatine supplementation is widely utilized for muscle growth and has garnered substantial evidence supporting its benefits for older adults. Studies increasingly indicate that creatine helps mitigate the decline in muscle mass and even facilitates muscle development, particularly when combined with exercise. This enhances strength and reduces the likelihood of falls. Resistance training is imperative for both older men and women, offering advantages beyond reduced fall risk, such as improved bone density, decreasing the probability of fractures. While I don't advocate creatine for everyone, for seniors aiming to fortify their muscles, the evidence is compelling enough for me to endorse it. Creatine is generally well tolerated, but potential side effects include water retention, temporary weight gain, decreased joint mobility, muscle cramps, and nausea. A typical dosage is 3 grams daily, but those with renal impairment may require a lower amount and should consult with a healthcare provider. Our health advocate regrets that individual responses cannot be provided but will incorporate questions in future columns whenever feasible. Readers may send queries to healthadvice@healthadvice.com or write to 420 Virginia Drive, Orlando, Florida 32803. C. 2022 Health Advocacy Syndicate Incorporated. All rights reserved. Please note that clicking on links, interacting with our site, and providing personal information may result in data collection, recording, and storage by us and our social media and third-party partners, in line with our privacy policy. https://www.healthadvice.com/privacy-policy.html